so now some very specific things for pain management when you get home. We've talked about the magnesium. You want to know what kind of doses of ibuprofen and Tylenol you can take and how to balance them out. You want to have a pain plan, not only with people you're going to call, but also activities, things to entertain you, because being distracted is a really effective way to decrease pain, because it takes up the area and the part of the brain that's interpreting danger, and it fills it with a movie, so you're no longer as focused on the pain, so you're not feeling as much pain. Now, for the physical pain itself, one thing that's really effective is to use a very specific frequency of vibration. And this is kind of like if you bump your elbow and rub it, you don't feel pain, or if you're stretching and moving, sometimes that makes you not feel pain. This particular frequency is the one that activates your position sense. So in the joints, there are nerves, and it's more important to your brain to know where your body is in space than it is to feel the pain, because once you've had the alarm, you need to be able to run away from whatever hurt you. So this nerve of where my body is outweighs and short circuits the pain signal. So this vibration unit is the frequency that triggers those nerves, and it goes into a pocket that you can put upstream. So these are available online. You can have the vibration, you can trigger it, and then take ice packs out of the freezer and put it on. Now, a lot of times you're going to have a game ready or something that's circulating cold water immediately after. Once those go away, and even before, the nice thing about the VibraCool is you can actually move around a little bit, so you don't have to be plugged into a wall. And you want to set the device just upstream of where it's most painful, or if you're having cramping of the IT band, you can put it directly where you're cramping. So putting this on and knowing you have it is something helpful. If you are cramping, there are hot packs that can go with it too. One thing to decrease catastrophizing is knowing you have options. So knowing that you can use vibration in the right frequency, you can use ice, you can use heat, you can use rollers, and you could even invest in a couple of different additional things, because knowing that you've got something else to turn to is really helpful. This is a really simple, the VibraCool is a really simple, easy way, but you could also get a hot and cold thing that you microwave or that you freeze. You could get massage stones. There are a lot of things that don't necessarily have data that can still be things that may be helpful to try, and if nothing else, they're going to spend a little bit of time, and the farther away you get from surgery, the less pain you feel. So there's a lot of data about VibraCool. It's about 2 to 4 times better than TENS units, but there's no reason not to try a TENS unit. There is a whole list of things to try, from the supplements, the turmeric, the magnesium we talked about, different kind of physical things, yoga, stretching, pressure, the vibration and ice, and then meditation, emotional support, things to decrease the catastrophizing and to help you get your mind off of pain. So bottom line summary, expect that you're going to be needing to cope with pain for about 2 or 3 weeks. You will have pain that is 4 out of 10 only for about 2 days, then it'll be about 3 out of 10, and then within a week or 2 it'll be 2. So that's about the way that it goes down. And exercise before, exercise after. Doesn't have to be as intense, and home physical therapy works just great. And make sure you've got some pain devices and pain plans that you can use at home, and that is how you cope with a knee or a hip surgery. Thank you.